Mr. Robbins, we may begin when you're ready.
Good morning, everyone. I'd like to call to order the Insurance Benefits and Ledge Committee meeting for Cinco de Mayo 2022.
Thank you, Chair Robbins. This meeting is being conducted virtually, so I will do a roll call of the trustees to confirm attendance. Mr. Knox is not here. Ms. Ginsburg,
Good morning here.
Mr. Santos,
Here.
Ms. Gray,
Good morning.
Mr. Bernstein, Mr. Sanchez, Mr. Moore,
Here.
Mr. Kehoe,
Present.
Ms. Zapanta, Mr. Pryor,
Here.
Mr. Harris, Chair Robbins.
Present.
Staff participating in the meeting include CEO Santos Kryman, DCEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, from Retiree Healthcare, Cassandra Smith, Director, and Kathy Magida, consultants Stephen Murphy, Richard Ward, Michael Zito, Stephanie Messier, and Amber Turner from Siegel. Trustees, please use the Zoom chat option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda.
Thank you very much. Item 1A is approval of the minutes of the regular meeting of April 6th. I need a motion.
I'll move.
Second.
Are there any corrections or changes? Seeing none, go ahead and call the roll.
Ms. Gray,
Aye.
Mr. Kehoe,
Aye.
Mr. Moore,
Aye.
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Item 2, public comment. Is there anyone from the public wishing to address the committee, Terry?
I have no requests.
Thank you very much. We're on item 3A, recommendations submitted by Mr. Liu that the committee recommend the Board of Retirement adopt a support position on AB 1971, which would make administrative amendments to Searle. There's a April 22nd, 2022 memo in the packet. Mr. Liu, do you want to briefly tell us what this is all about?
Yes, good morning, Chair Robbins and committee trustees. So this is one of two bills that the SACRS is sponsoring. The other one was AB 1824, which were also technical amendments. This bill proposals were a little bit more substantive, so that's why they were put into a separate bill instead of that other bill. And so there were a list of proposals here. As you can see, some of those proposals had to be taken out due to the fact that the SACRS Legislative Committee had been engaging with some of the labor groups such as SEIU and PORAC and the professional firefighters. So what we have left here are these various proposals. I'll just highlight the proposal about disability retirement applications and service retirement. That was one that we had submitted to SACRS to put into this bill. And what this would do is basically right now, if you put in an application for disability retirement and then you later retire for service, once you're granted disability retirement, you can then change your option. But historically, if the reverse happened, then you couldn't change your option. In other words, if you retire for service and then apply for disability, it didn't happen. So what this would do is allow that to happen as well, regardless of the order in which you either apply for disability or retire for service. This would still allow you to change your option if you were to be granted disability retirement. So basically that's what I want to highlight from the bill. I'd be happy to take any questions.
Are there any questions? Seeing no questions, I'll go ahead and accept the motion.
I'll move the recommendation.
I'll second.
Any further discussion? Go ahead and call the roll.
Ms. Gray,
Aye.
Mr. Kehoe,
Aye, and thank you, staff.
Mr. Moore,
Aye.
Chair Robbins.
I'm an aye.
The motion passes unanimously.
Thank you very much. We are on item 4A, engagement report for April 2022. Mr. Liu.
Thank you, Chair Robbins. So some items of interest for you this month. So the first couple of items are kind of a buyer's remorse about systems that have abolished your pension plans are now going to reinstate them because they have challenges in hiring and training and recruiting members. So Alaska in 2006 abolished this pension plan for a 401k style plan, but now they've introduced a bill to bring back the pension plan for police and firefighters. That would require 8% contributions and retirement at age 55 with 20 years of service. The reason is that they found that again, it's just costly to hire and train and to retain people. But besides safety members, Alaska teachers are also advocating for a reopening of their closed teachers pension plan. That's be more expensive, but again, those are the same concerns about recruiting and hiring and training. And then Oklahoma in 2014 also phased out its pension plan for a 401k plan. Now they're voting to bring it back because they want to be able to better recruit and retain employees. And so since 2014, they've been operating two separate plans, which means they have higher administrative costs. And then the remaining items are kind of regarding an item that's is on everybody's mind today. It's inflation and in cost of living adjustments for pension plans that would help offset that. So the New Jersey plan in 2011, Governor Christie had phased out COLA adjustments, but now they're faced with a kind of a stark choice between bringing back COLAs with a price tag of $3.6 billion, or else waiting a couple of more decades before the plans reach a funding level of 80% in order to pay, COLAs. So I've listed a list of plans here, and you can see how long it would take for them to wait to reach 80% before bringing back the COLAs versus, paying for it now at $3.6 billion. And Kansas also is bringing back the COLAs, but it's going to be a one-time COLA, it looks like, and they haven't received a COLA since, the 1990s. And then lastly, the Ohio Teachers Retirement System, they're going to approve a one-time COLA of 3%. And they're currently 80% funded. They've also had pension reforms that had currently, slowly ratcheted up the requirements for retirement, say from 30 years of service to 35 years of service. And you may recall from last October, this system is currently facing a state audit over reports about, certain investment fees that it has been paying. So that concludes my report. Have you taken any questions?
Does anyone have any questions? Thank you very much. Some interesting developments going on around the country. Stand by to stand by. Item B, staff activities report for April 2022. Cassandra.
Yes, good morning, Mr. Chair, members of the committee. Just one item to report. We've completed another round of the application process for a retiree drug subsidy program participation. You may recall under this program, we receive a reimbursement of 28% of the allowable drug expenses that fall among the federal guideline or designated cost thresholds. So we've done it. We've completed the 4 applications that we usually do from each year to year. That's it.
Thank you very much. Anybody have any questions for Cassandra? We will go on to item C, medical and dental claims audit findings. I will turn it over to whomever from Siegel is going to address this issue. Or Cassandra, do you want to start it out or what?
That would be Amber. Amber
Okay.
is the Siegel auditor that assisted us with the auditing of both our Anthem Blue Cross and Cigna dental vision plans.
Thank you very much. You've got the mic, Amber.
Thank you. Okay, I tried to share my screen, but it's not letting me. So does everybody have the presentation material and I'll just go through it. Okay, so today we're going to discuss the Cigna dental and audit for the medical anthem. We're going to go over the results, the key findings, and any follow-up items that we do have. For the Cigna audit, we picked up where we left off and we started with July 1st of 2020 and we audited through June 30th of 2021. We did do a statistical sampling of 225 claims. And through those 225 claims, we did, find that they did financial accuracy meet your performance guarantee. The financial accuracy was mapped at 99.98%. Your performance guarantee is 99%. The payment accuracy was 98.89%. And it was mapped at, your performance guarantee is 95%. So you met there. And your overall processing accuracy was 98.89%. And the performance guarantee was 97%. Time to process was 95.81%. And your performance guarantee is 93%. Although this is great findings and they did pass, we did find some errors within that information. Some of the key findings that we found, there was co-insurance application applied to 2 claims at 20% for personal protective gear. Upon finding this, I did reach out to Cigna and ask them that they generate a financial impact report. As you can remember, at the start of the pandemic, Cigna did incorporate personal protective equipment, and they did state that that would be at 100%, meaning that there would be no member liability to that. We did find that they were taking member liability, so we asked them to generate a financial impact report that they did find 3,019 claims were affected and $4,830.40 was found and adjusted as of January 5th of 2022. Another point that we did find was they processed the claim as primary when the spouse had secondary, when this should have been secondary because the spouse had insurance. They did agree to this finding and they did adjust the claim. That was in the amount of $1,580. So all in all, we can say that Cigna does do a pretty good job with handling the dental portion. Although these findings were found, I can say through my experience, there's never really been an audit where it's 100% clean. We always find, something, whether it be little or big. And this to me is pretty small. So we can move on to the Anthem medical claims audit. So for the Anthem medical claims audit, we did do the same thing. We left off where we came through. We started with July 1st of 2020 and audited through June 30th of 2021. And for this one, we had statistical and target sampling. We did 220 statistical random claims, and we did 35 target claims. Target claims are a little bit different because we are handpicking those claims done through electronic analysis. We are picking them basically because we think there's an issue with them. So we are handpicking those. The reason why we don't do this with your dental is because we don't have it in the contract where we can pick targeted claims because they do have bias behind them. We do see this a lot with, some contracts where, you can only do random statistical claims and you can't do any target, but this one is letting us do target. So we did do 35 targets on this.
Amber, are the targeted claims generally the larger claims?
No,
Okay,
not always. The targeted claims, we can say that there could be high dollars in there, but also it could be things that maybe we see that are repeated errors that may be systematic. We have to remember that, you know, around 85 to 95% of claims are now auto adjudicated, meaning that the system is paying them. So with this auto adjudication, you know, if they program something wrong, that means that anything that goes through that's auto adjudicated is going to be wrong as well. So we look for little things as far as, you know, co-payments being incorrect, co-insurance taken wrong, the out-of-pocket being over-applied. Little things like that can lead to bigger dollars. Even though we have a $20 copay, let's say, you know, they apply $35. Well, that's through a whole population, even though mine's only going to reflect, you know, $15 overpayment, that could be through the whole population. So for this, we did find that, you know, the financial accuracy, it did, you know, not meet the performance guarantee. It was at 96.5%. Your performance guarantee is 99%. The payment accuracy, you don't have a PG for that one. They did meet 98.86%. Industry standard is 97%. Procedural accuracy is 100%. Your performance guarantee is 97%. Overall processing accuracy is 98.86%. And you don't have a performance guarantee there, but the industry standard is 95%. And then the time to process, they did meet your performance guarantee of 90%, and it was at 95.54%. 30-day turnaround, it's 98.57%, but also we have to keep into account that adjustments can be in that, so it can throw that number off. We're thinking that it's probably closer to the 100% than we think. Okay, so from the statistical results, in addition to 4 errors that we found 9 out of sample errors that were identified. The 9 errors include 1 overpayment for $39,850.35 and 3 underpayments totaling $5.67 and 5 procedural errors. Out of sample claims are claims that we identify through the sampled claim. Normally when we are auditing, we look at the sample claim as well as the history. So we're going to look through all the claims within the history and see if there's a trend. If we find that there is a trend, we do note this as out of sample because it's not in our sample, but at the same time, it could be, you know, these are errors and we still want to account for them. Okay, so due to the nature of the target sampling, which I have gone over, it's, you know, there's bias there. The results aren't included in the statistical achievements and calculations, nor is the out of sample. I do want to make that clear. The review of the 35 medical claims in the 12-month period, we did identify 14 in sample overpayment errors totaling $12,125.77. And then in addition to the 14 overpayments, there was 9 out of sample errors that were identified. 9 included 1 overpayment for $39,850.35 and 3 underpayments totaling $5.67 and 5 procedural errors. You know, and again, out of sample claims are identified through the member's history. So the key findings from the medical claims audit, this is where we're going to get a little bit deeper into what those errors actually were. There is, a constant issue, and we went over this last time in regards to the out-of-pocket with the commingling from the pharmacy. The individual deductibles were over applied, but the out-of-pocket maximum was not met on 5 claims. And then the individual deductibles were over applied, but the out-of-pocket maximum was met on 4 claims. The 5 claims are the procedural error because the out-of-pocket was not met. They still had a financial responsibility. The 4 claims that we did find where they already met their out-of-pocket, those are going to be your underpayments in the amount of $14.80. And this has a lot to do with timing. How fast does the pharmacy get over how much the member paid? How fast does Anthem apply that amount that the member paid to the out-of-pocket? So this is a reoccurring error that we find every year. And we do recommend that LACERA monitor the situation, as this error has a potential to cause members to incur a higher out-of-pocket expense. Another one of the findings that we did find, the incorrect coordination of benefits with Medicare led to underpayments. They did agree to this error and they did adjust these claims. There were 2 claims. They were manual, meaning that somebody manually intervened and did not coordinate correctly. That was in the amount of $1,151.92. We found a workers' compensation claim that was paid. We did inquire about this through Anthem. Anthem noted that an investigation into the claim was initiated, and we do request that LACERA monitor the workers' compensation claims process. Even though this was $612, that's $612 at that moment. So, it could keep piling up and it could get bigger. So
Amber, I have a question though. We don't have the ability to access all of that workers' compensation information. So your recommendation is a difficult one because workers' comp is a different system. And like I said, we don't have the ability to dig into that and do that. It's just not possible.
Yeah, and that goes a lot with reporting. Anthem should be supplying reporting in regards to claims that are workers' compensation that are being reimbursed. I'm not sure if you guys get that reporting. Cassandra, do you? No. Yeah, a lot of the times you don't get it unless you request it. And that's something that I would look into just to make sure that, everything's on the up and up.
Okay.
So the next error is in regards to a terminated member. Anthem did disagree with this error and said that Anthem paid with the eligibility information on file at the time of processing. They said they received the eligibility request April 29th of 2021, and the claims were incurred 60 days, before incurred after, the 60-day period. So you have a 60-day period. Once they receive the notification that the member is supposed to be terminated, they go back 60 days. Now, if this termination is late, they're still only going to go back 60 days, is what they're saying. We do ask that, LACERA kind of discuss termination timelines with Anthem and just make sure that everybody's on the same page in regards to, you know, when termination has to be turned in, just to make sure that, you know, members that are not paying for the plan no more are not getting compensated for it. We did find 3 claims for acupuncture that were paid over the $30 in-network limit. And 1 claim did not apply the 50% co-insurance out of network. Anthem agreed to these during the remote review and adjusted the claims. We found 3 orthotic claims that were paid for, you know, a diagnosis other than diabetes, which is in your plan document. Anthem is disagreeing. They said that the diagnosis of pain in the foot is not an exclusion. They said that they allow beyond this. And we did recommend that you kind of discuss the intent with Anthem and just to ensure that everybody's on the same page with this benefit. Hearing aids on 3 claims were paid over the $300 amount. And they did agree to this during the remote review and adjusted the claims. And then we also identified 5 duplicate claims that were paid. And again, they agreed to these errors during the remote review and adjusted the claims. Now, in regards to our follow-up items, the follow-up items that I really want to focus on is, you know, the individual deductible and out-of-pocket maximums exceeding, because this is reoccurring. You know, it's every time that we audit, we find this, and it has the potential to cause members to incur higher out-of-pocket expenses. That we really want to get this down to a science where, you know, Anthem understands that, you know, these have to be coordinated quick to make sure that the member's not paying more than they should have to pay, you know, or compensation is given when they see that it's, you know, the member's paying a higher expense. The workers' compensation claim, again, you know, I would request that information from Anthem and just make sure that they're giving you some type of a reporting. I know they do it for other clients, so it shouldn't be that far of a jump for them. And then the terminated members' claim timelines. We just want to make sure that, you know, everybody's on the same page and discusses when that information needs to be turned in, and, you know, how long do you have before everybody is, you know, on the same page in regards to, okay, if I send in a claim and the member's terminated, we're denying this. We're going back 60 days, we're looking at it, but, you know, it's important to also make sure that the eligibility is turned in on time, and that, you know, any member that's not paid into the plan does not get paid when they're not supposed to be. So does anybody have any questions?
Amber, Steve Murphy. So just before you conclude, thank you for going over the material and kind of pointing out the value of doing an audit on an annual basis, because it does point out kind of where things may be going awry. It does highlight areas where perhaps the administrators, you know, improperly doing things. But what I want to stress for the board members is that doing an audit on a fully insured program is actually atypical. You typically only see this done for self-insured programs. And so again, I think that's kudos going to Cassandra Smith and Kathy Magida and Leilani Ignacio with regard to kind of establishing this and maintaining it, so that the board understands when the vendors are performing well and when there are opportunities for us to kind of refine it and make improvements. So thank you for the findings.
Thanks, Steve. Anyone else have any comments or questions? Cassandra, anything from you?
No, other than we will definitely be following up with Anthem with the recommended recommendations from Siegel.
And I just have one quick last question for Amber. Amber, our overall, your feelings about the audit, good, bad, indifferent?
I would say good. Very rarely do I find audit, especially medical, that comes out clean. And I just want to stress that, everything's going to be a problem. There's always going to be some type of human intervention. So very rarely do I find an audit that comes out 100% clean. So I would say I have good feelings about this. The only thing that's giving me a little bit of pause is the out-of-pocket maximums, because I don't want the members to be paying more than they have to pay.
Neither do we. Okay, thank you very, very much.
Thank you.
If nobody on the committee has any questions, we will move to item D, LACERA claims experience, and you're up, Steve.
Thank you very much. Again, first page, just a highlight of the distribution of premiums and enrollment. So no dramatic changes there. Page 2, looking at the historic renewals on the top chart. And the bottom chart is looking at the costs on a per retiree per month basis in aggregate for Anthem, Cigna, and Kaiser. I think you'll notice for both Anthem, specifically, it's a 12% increase. Again, I want to highlight, like we talked about last month, we're starting to compare ourselves to kind of the peak of the pandemic. So this 12% increase for Anthem, as an example, is certainly eye-catching. If we take a look back at the 12-month period preceding the 1523, that amount was around 1587 per retiree. So again, kind of if I compare pre-pandemic to where we are today, it's about a 7.5% increase overall. And that's right around where we're seeing medical trends. So that's probably less alarming, but we'll continue to monitor that. Cigna, again, has a very small population. So again, we'll continue to see fluctuations, but a 3% increase year over year. And we presented the Kaiser material last month. It's the most recent update, and that is primarily being driven by some large claim activity. And if we apply the same approach that we did for Anthem, kind of looking back pre-pandemic, year over year, we're probably looking at about an 8.5% increase. So again, quite within the realm, but we'll continue to monitor that as we go forward. This chart will give you a snapshot of the activity across the Anthem plan designs. Anthem on a combined basis on the far left-hand side, about 11% increase. Period over period, 12.1% for the non-Medicare plans. Breaking that down, that's plans 1 and 2, about a 12.8% increase, and prudent buyer down about 1.3%. And then lastly, looking at plan 3, which is the Medicare supplement, that increased by about 10%. This is the Kaiser report. Again, we looked at this last month, but again, probably the thing of note is that we have 2 large individual claims totaling about $1.6 million. So that is the key driver overall for that snapshot of time for Kaiser. From a large claim perspective, I guess that graph tells us everything. As we noted just a moment ago, that large claim activity for Kaiser is kind of unprecedented. So that's really kind of driving what we're seeing for that. If we look at the pharmacy rebates on the Anthem CVS program, averaging about $149 per retiree per month in rebates, and that accounts for about 26.6% of total claims. So right around within the historic range. And the last page on the experience report is a breakdown of the dental and vision claims. It's truly a case of kind of the bridge between kind of pre and post pandemic. If we go back to the period just preceding it, which would have ended March 31st, 2020, we're essentially at pre-pandemic costs now for dental. So the 5858 and the 240 for vision, those are pretty much spot on to what the costs were for those 2 plans before the pandemic. Any questions on the experience report today?
Mr. Santos?
Sorry, no questions. Did I raise my hand?
I guess we're going to move right along, Steve. Federal legislation.
Okay, I'll carry the town. We were able to share past the deadline, but just some quick updates on compliance issues that impact the plans. First, the COVID-19 public health emergency has been extended into mid-July. Interesting about the communication was that they intend to give states 60 days notice prior to termination of the health emergency. So we'll have to see where that goes. Saying we're probably getting within that window here shortly if the intent is to end it by July or August. What's important about the extension is, again, it allows individuals to get COVID tests and treatment at no out-of-pocket costs, tests at no cost. So that's a key element of that. And then just of note, American Disabilities Act requires states and local governments to make sure their websites are accessible. So that includes screen readers for people with vision impairment, captions on videos, things of that nature. And on March 18, 2022, the Department of Justice released guidance on how to make websites more accessible and intimated that they intend to use their enforcement authority to ensure that websites are accessible for those with disabilities. So something I think to keep an eye on as we go forward.
Anyone have any questions of Steve? I am not seeing any questions. Thank you very much, Steve.
Okay, thank you.
We are on item 5, items for staff review. Cassandra or Terry?
I have nothing.
How about good of the order? Anyone have anything in good of the order? Just raise your hand or give me a heads up and I'll call it. Or we can save it for the board of retirement meeting. Nothing on the good of the order. How about a motion to adjourn?
So moved.
Thank you very much. The committee meeting is adjourned.